right on top of those sit bones right there. So what I'm going to do is I'm going to take the skeleton, and I'm going to let him sit on my skin, my arm. I'm going to pretend that this is the skin inside my body, okay? And I'm pushing down with a little bit of force here, as much as I can through my arm. But you have to think about it. If you're 6 feet tall, let's say you're 6 feet tall and 200 pounds. You probably have about 150 pounds of force coming down in this upper body, pushing down into your hips. Maybe you're 5'5" and 130 pounds. Well, you probably have about 100 pounds pushing down of force. I'm not pushing down with 100 pounds or 150 pounds. I'm probably pushing down with 20, 25 pounds of force. Okay, not very much. But what you'll see that'll happen is when I go to lift this skeleton, my arm will be very white where these bones are touching because it's pushed away the blood in that area. And then you'll watch it rush back to a red. You'll see the blood rush back in and it'll return to its normal skin color. So you ready? Everybody watch my arm. 3, 2, 1. It's white and then it rushes back to a red color. And the blood supply comes back and fills in. The problem is if you stay sitting in your wheelchair all day and you don't do a weight shift or move around, then there's no blood getting back to those areas, okay, underneath right here or right here, the tailbone, right? There's a whole bunch of pressure that you're just pushing down and pushing down. So you need to do things like lift up in the chair or tilt to one side or tilt your chair all the way back. And when you tilt your chair all the way back, you have weight that goes onto your back to allow blood flow to get to this area right here. Super, super important. We're going to talk a little bit more about that here in just a few minutes, okay?